We've spent 20 years, haven't we, in health services designing competition between, units of organisations. So be that between hospitals to some degree, you chase the money. So you're creating competition between primary and secondary care, community services, all those sorts of things. So we've had quite a small scale. I know they're still large organisations. They employ tens of thousands of people. They run at £1 billion, a year. They're big organisations in one sense, but actually they've been designed to be in competition with each other, and that has driven certain benefits. You would look at certain times and say, well, that had a benefit in terms of some of the elective treatment times and what have you. But we're now in an era of encouraging collaboration, and I think the provider collaboratives are where we're encouraging providers to work together. So some are absolutely provider collaboratives of the same sector. So they're 3 hospitals joining together, working together. And what they might do is they might look at some of their support functions, procurement, finance, HR, and say, well, we don't all need one of these. We could share that. They might look at their clinical front teams and say, actually, we're delivering, 3 bits of service, perhaps not as good as we could, but if we collaborated, maybe we could get a really good service and, structure it slightly differently. In all of this, you've got the public voice in that. So I'm aware of local initiatives around stroke services at the moment, where 2 organisations not that far apart are trying to reconfigure. But of course, that's contentious. The public have a view about, what they want at their local hospital. But so part of it is about single sector organisations working together. But increasingly, I think what we'll see is cross-sector. We will see hospitals, mental health trusts, community services, and elements of primary care coming together and saying, if we're genuinely going to offer integrated care, it's not helpful for us to be all operating in a slice of this, space, really. So there's a real opportunity here, but what we mustn't do is obsess about the structural change and have another load of structural changes without saying, but why? What difference is this going to make? So if the difference it's going to make is that a specialist is going to work more closely with a local team to look after people with long-term conditions, and they're going to spend more of their time supporting, educating, contributing to that and keeping people out there in the community, keeping them well, keeping them working, then you can see real benefit in that. So the vision has to be, I think, about what difference is it going to make, not just about the organisations being bolted together and scale being better than small scale.